The worldwide AIDS epidemic has been responsible for suffering and death on an unprecedented scale. This is especially true for the people of sub-Saharan Africa. It is here where more than two-thirds of all AIDS-related deaths occur each year. And it is here where the epidemic has left more than 11 million children orphans, threatening the social and economic fabric of entire nations. But despite these grim statistics, there are still people who refuse to give up hope. People like Fletcher Matandika. A native of Malawi and son of a Christian minister, Matandika founded an organization in 1999 called Ministry of Hope to meet the physical and spiritual needs of a desperate generation of Malawian children. Since then, Ministry of Hope has developed programs for orphaned and vulnerable children that include community care centers, Christian worship and discipleship programs, educational scholarships, vocational programs, a crisis nursery for infant orphans, and volunteer support programs. Since there are virtually no government resources in Malawi to feed the growing number of orphans, Ministry of Hope has established community centers in villages throughout the central region of the country, and they serve a daily meal to several thousand children 6 days a week. The community centers are a joint effort between Ministry of Hope and local villages. Land for gardens and buildings is donated by the villages. Food, supplies, and construction costs are funded by Ministry of Hope through the donations of people from other countries, primarily the United States. The core mission of Ministry of Hope is to nurture the spiritual lives of children who face a harsh and difficult existence on their own. After each meal, children hear a message of hope on Christian faith and living. Ministry of Hope staff and volunteers come alongside the children to play games, lead Bible studies, and organize their participation in a village choir. Ministry of Hope also cares for some of the smallest orphans through a network of crisis nurseries. The first crisis nursery was started by two longtime Presbyterian missionaries to Malawi, Frank and Nancy Dimmock. They began caring for a handful of infant orphans in their Lilongwe living room. Today, there are crisis nurseries that operate out of dedicated facilities in Lilongwe and the northern city of Mzuzu.
Crisis nursery is a sub-theme of Ministry of Hope in terms of the programs that we are running. And through that, we give them a formula, which is food. We provide clothing. We also provide medical assistance to these babies up until they reach 6 months, which is a time that is recommended that they can now begin to get other foods. So when they reach that level, we graduate them back into their communities so that they are embraced by their either guardians or grandparents or uncles, because there is still a family system in the community that can take care of them.
Taking care of these babies, at least it requires love, a lot of love. You need to show love to these particular babies. So this love can be shown in various ways, even just by people coming around to see what we are doing and just have a chat with these particular babies, because what they need is not money, what they need is not anything. But if you try just to show them their love.
Ministry of Hope is also involved in the educational development of the children. In Malawi, there is no free public education after the 8th grade. Without the support of a family, a child's education would end at this point. Ministry of Hope helps needy children continue their education by providing scholarships that will support them through their senior year in high school at a cost of about $30 per month. Who are the people of Ministry of Hope? Oversight of Ministry of Hope comes from a Malawian board made up of local church and community leaders, and by a U.S. board that promotes and supports the ministry abroad. The day-to-day operations are conducted by Malawians from a base in the capital city, Lilongwe, and by volunteers in each village who work with a center director. Ministry of Hope is fortunate to also have a wealth of volunteers from nearby African Bible College and from short-term mission groups from the United States. Volunteers work alongside the Malawian staff and directly with the orphans in educational programs, food distribution, worship, and Bible study. There are also innovative outreach efforts, such as the mobile medical clinic, where volunteers can have a significant impact.
Yeah, the mobile medical clinic is really an extension or an arm of Ministry of Hope. It fits the mission of Ministry of Hope in providing basic needs and care for the vulnerable children, the orphan children, the widows, and any other people who are destitute in the community. And so we felt that it was a nice complement and an important complement to provide some basic health care needs for the community, to restore their dignity, provide some hope and some relief of any suffering they may have, along with everything else we provide with Ministry of Hope. So it's a nice complement to the whole Ministry of Hope mission.
The prayers and financial support of people worldwide allow Ministry of Hope to serve the spiritual and physical needs of the orphans in Malawi. Since the needs of this ministry recur every month, please prayerfully consider a commitment to give monthly. Scripture says that true religion is looking after widows and orphans in their distress. Ministry of Hope is putting that call of service into practice by working to redeem the lives and futures of the most vulnerable victims of the AIDS epidemic. In a land where hope is in short supply, we urge you to become a partner in this Ministry of Hope.